Well, Mr. Chairman, I just thank you for allowing me to join you at today's subcommittee hearing, and I appreciate this panel for being here. These issues affect hospitals all over the country, and I've heard countless stories from Kansas hospitals about the difficulties they face surrounding the Medicare program. Lawrence Memorial Hospital in Lawrence, Kansas has asked that I share their perspective on recovery audit contractors. The hospital currently has $4.7 million being withheld because of RAC audits. It has appealed nearly all RAC audits, and so far has demonstrated a 96% success rate in the appeals process. Lawrence Memorial has brought to my attention what is a valid concern that I'm hoping that you will take into consideration. The hospital is forced to disallow Medicare days and discharges that are currently held up in the RAC audit process because of the massive backlog at the ALJ level of appeal. And the hospital is concerned that these audits, which are likely to be resolved in their favor, will not be completed within the 3-year window during which it can reopen the cost report window and count towards the EHR meaningful use requirements. This is just one of countless hospitals in Kansas that is experiencing the immediate and ancillary effects of the current flawed system. As we continue to discuss a way forward on this topic, please take this problem into account. Secondly, I'd like to highlight a program with the 83 critical access hospitals in Kansas and others around the country and what they are experiencing. I received a letter from the Anderson County Hospital in Garnett, Kansas, and I would ask the chairman's consent to insert the letter into the record.
Without objection.
This letter details the hospital's problem with CMS's final OPPS rule for 2014 regarding outpatient therapeutic services at critical access hospitals and supports legislation that I've introduced to delay enforcement of the rule until the end of 2014. This rule, while well-intentioned, is creating a regulatory hardship in rural settings. The letter notes that CMS has disallowed physicians at a hospital-based rural health clinic from meeting the direct supervision requirements, which makes it very difficult for Anderson County Hospital to be reimbursed by Medicare for services rendered. The most troubling part of the letter is that the hospital notes that the physician supervision requirements have no impact on the quality of care, and that the hospital will administer the outpatient therapy even without the Medicare reimbursement. This is a telltale sign of a misguided rule that has missed the point. So, Mr. Kavanaugh, is it your opinion that requirements on physician supervision of outpatient therapy services at critical access hospital are feasible, and would CMS benefit from a delay in enforcement in order to revisit this rule?
First of all, thank you for telling us about the experience of these two hospitals. I don't have an opinion on the delay, but I'm interested in the issue, and I'm happy to look into it further outside of this hearing if you're willing to share that experience with me.
Okay, we will follow up with you and would like to work with you to give these folks some relief and better care for Kansans.
I'm more than happy to look further into it.
Okay, thank you, Mr. Chairman. I yield back.